Hello, everybody. I am Dr. Dan. Welcome to the Suburban Wellness Group podcast. I'm your co-host today. With me is Dr. Natasha Fuxina. She is my partner at Suburban Wellness Group. And we have a very special guest on today, Dr. Ellie Campbell. She is a good friend of mine. We've known each other for quite a long time. She is one of my favorite people of all time. Ellie, Dr. Campbell, welcome to the podcast.
Thank you so much. It's my pleasure to be here with you today. Always, Dan.
So what I want to do, thank you very much. What I want to do is I want to go over your bio, and then we're going to talk a little bit about COVID and immunity. We're going to do some educational stuff. So Dr. Campbell is from Chicago. She has a BS MS from the University of Illinois. She's an osteopath, DO, from the Kirksville College of Osteopathic Medicine. She did her family medicine residency at the Medical College of Georgia, board certified in the American Academy of Family Medicine by the American Board of Integrative Medicine and Integrative and Holistic Medicine. She owns a solo concierge-style integrative and holistic family practice in Cumming, Georgia. She sees a lot of interesting patients. She does functional medicine. She's into oral systemic connection, herbal remedies, prevention of stroke and heart attacks, bioidentical hormone replacement therapy, vitamin D. Dr. Campbell, welcome.
Dr. Dan, thank you.
How are you today?
I am marvelous. Thank you
Excellent.
for asking.
So, sometime in the beginning of the year, there was this virus that has invaded the United States of America and has gone throughout the world. And it's COVID-19, and it has caused some issues and some problems, a lot of deaths, a lot of respiratory issues. Dr. Campbell, tell me, how is it in Georgia? What is your experience in treating COVID-19 patients?
Yeah, so I would like to back up just a little bit for the listeners, because I think a little point of education is worthy at this moment.
Absolutely.
There's still a lot of nomenclature that floats around, and I just want to make sure everybody's clear on what we're talking about. So we have many, many, many types of viruses in our world. One type of viruses is called coronavirus. Most of those coronaviruses get specific names, and the one that has come out somewhere between December and now has been named the SARS-CoV-2, SARS-CoV-2. It's very similar to the SARS-CoV with no numeral associated with it, SARS-CoV, that caused the SARS epidemic, and it's similar to the MERS virus. All three of them are coronavirus. The disease caused by the SARS-CoV-2 virus is called COVID-19. So COVID-19 is the name of a disease, not the name of a virus. If we're going to be specific, or if you're reading about it in the New York Times or the Lancet or whatever your medical journal of choice might be for the day, just want to make sure everybody knows those terms. So what's happening here where I live? Not a lot right now. We were somewhat blessed. I think during the Passover season, I felt that we were mostly passed over here in our community. In our local community hospital, we have had a total of 12 deaths for the entire county. So not a lot of coronavirus. In my own clinical practice, I had, I believe, 3 cases. One was a college kid that I did not diagnose, that I did not test, but he had every checklist of symptoms. He was in spring break in Florida. He entertained some college buddies that came back to his fraternity from Europe, where they'd been doing study abroad in places that had coronavirus, and then he got every symptom checklist. And then I had one patient that lives locally that had the symptoms. I tested her nasal swab, went out to the car, put on my personal protective equipment, swabbed her nose in the car, sent the specimen off to the lab. It came back negative, but she had every checklist symptom. A month later, I checked her antibody test, and it was positive for IgM only, not for IgG.
No IgG.
Another month later, the IgM had cleared, and only the IgG was positive. So I have only one proven case. The third case was actually a physician with every checklist symptom in the book. His nose test was negative, and his blood test was negative. So I think that we have a lot of coronavirus here that's not being picked up by our tests. But I also think that compared to many places, New York, New Jersey, Washington, we have a much less burden of coronavirus.
Right.
Well,
Beyond that, I have a functional medicine practice. My patients walked into this virus mostly replete with all the things we're going to talk about that support your immune system. And so I believe that in a lot of ways, our patients were more bulletproof from catching the virus than the average population. So I did not expect to see a lot of coronavirus, and indeed I have not. Dr. Natasha, what did you want to add?
Right. I just wanted to comment because we are in a different geographic location. We're in New Jersey, North Jersey, just 20-25 minutes from New York City. So we're hotspot and still are, even though the cases are declining and the case fatality rate is declining. However, I would like to say that I did see a lot of patients with coronavirus symptoms, which were diagnosed with swab tests or saliva tests, and which were clinically diagnosed, like you mentioned in your practice, with negative swab tests, but in my mind, they had a clinical diagnosis of COVID-19. And my practice is a mixture of internal medicine with a traditional component and with a lot of integrative functional medicine component. So I also believe, because my patients were also better prepared to meet any kind of strain on their immune system, so they were able to better mount a response, because there was obviously rampant in the area. We've done very, very well with patients, knock on wood. So far, it's not over yet, but we did not have any fatalities, and I'm very happy. We've treated a lot of patients. And I also can tell you from my observational experience, not all tests are created equal, and these tests are still new. So there's a difference between sensitivity and specificity across different laboratories, different nationwide laboratories like LabCorp Quest and private laboratories that we're working with. So I do see differences in sensitivity and specificity. One comment that comes from observation in my own practice is that the rapid tests for IgM and IgG are probably more useless than helpful. I think there are a lot of false negatives with those tests, so I stopped doing them as availability with other laboratories and other testing has become much greater. So we do use...
For the audience, those rapid tests kind of look like a home pregnancy test, with the lines on them if they turn positive. And the advantage is they're super quick, right? You can know in a few minutes. The disadvantage is they're not very accurate.
They're not accurate.
The information that they're providing, as much as in the laboratory, they look like they were going to turn out to be really good. In our collective clinical experience, not so much.
It's not. Now, Dr. Campbell,
I stopped doing them. Yes.
So Dr. Campbell, you mentioned functional medicine in your patient base. All of your patients were ready to fight this off. And for our viewers that don't know exactly what functional medicine is, why don't we just discuss that for a few minutes?
Yeah, so functional medicine is a framework, a way to look at a patient using a very specific diagnostic approach and framework. Some people call it for short, root cause resolution medicine.
Right.
What's fascinating about it is you don't have to be an MD or DO physician to practice functional medicine. As long as you have advanced healthcare training, I have nurses who are functional medicine experts, health coaches who look at functional medicine, chiropractors who do functional medicine, naturopaths who do functional medicine, acupuncturists. So it doesn't matter what lens you come in, because functional medicine is a framework that looks at root cause resolution of what it is that got the patient into this position and how we're going to get them out of it.
Right.
We look at a framework that includes things called antecedents, triggers, and mediators. These mean what was underlying before you got sick? What was the major first trigger that set things off? Because often, if you think about a camel collapsing with straws on its back, the the back is getting heavy, the more straws that are going on, but one straw collapsed the camel.
It knocks you all down.
Many patients will say, I was never well since, and they know the specific time that they got sick.
Right.
But that wasn't the one thing. Just like we're seeing with COVID, right? COVID is putting some people in the intensive care unit. It was the straw that broke their camel's back, but there were so many antecedents and triggers before that episode, or antecedents before that episode when COVID triggered it. It just held the magnifying glass up against all those pre-existing, the new vocabulary word for America, comorbid conditions, right?
And we're going to get into that next, yes.
Yeah, now that we see those. So antecedents, triggers, and mediators. A mediator is something that's allowing a chronic thing to perpetuate.
Right.
COVID is an acute illness, but many of our diabetes, hypertension, depression, rheumatoid arthritis, these have mediators that allow them to continue. And if
what are those mediators? So let's get into the
Can't hear you.
Yeah, we lost your volume, Dan. You went on mute. You touched a mute button somewhere.
Okay, here we are. We're back. Okay, so let's talk about those
mediators.
Let's talk about those mediators. Explain a little bit more, Dr. Campbell, what these mediators are and why are they important when it comes to something such as the COVID-19?
Right. So we often think about mediators in chronic illness because they're things that allow that condition to perpetuate. So the vast majority of them are things that people know about, but really don't pay attention to. Let's say, for example, sleep. Almost everybody knows, if you took a random survey, how many hours of sleep should an average adult get? Most people will check the box 7 to 9 hours. Most people know that.
However,
how many hours do most people actually get?
Right.
Right? That's the problem. So, and even if you are in bed for 7 to 9 hours, how many people are getting deep restorative sleep during those times in bed? Right?
That's exactly what we talk about is restorative, that deep restorative sleep.
Right. A very small percentage of people are getting deep restorative sleep. Some people like me have very mild sleep apnea. My sleep apnea is so mild that my insurance company won't pay for a CPAP machine for me. But it provides many hours through the night where I don't get adequate oxygen. What do you think that does to all of my metabolism if it's running on low oxygen tone the whole time, right? My cells cannot be in optimal health if they're not getting good 8 hours of oxygen throughout the night. So my dentist solved that problem for me by creating an oral appliance that I wear that keeps my palate open and is over time going to actually expand the size of my oral airway so that I won't ever need a CPAP machine if my insurance would ever even cover it. I won't need it, right? Isn't that
right? The
idea of functional medicine? Get to the root cause and solve it. Why do I have a small oral airway? Because back when I was 14, 15, when I was in orthodonture, it was the treatment of the day to take out 4 teeth.
Right.
When we pulled those 4 teeth to straighten my bite, I lost a full centimeter of size in my mouth on each side of my face.
Right.
So I ended up with a mouth that was too small, which led to an airway that was too small. The good news is, even at 60 years old, it's not too late to fix it, right? So now that I've identified it, I can fix it. So there's one example, sleep, a mediator that we can identify and correct.
Very important. We can correct that with various recommendations to help out.
A lot of my patients are afraid to go have a sleep test because they won't wear a CPAP mask, or they have a bed partner that's had one and they found it too cumbersome.
Right.
Well, first of all, the technologies are better than ever before. The new CPAP machines are not much bigger than a cell phone. Many people can get by wearing nasal pillows, not a whole mask that covers their face, so the claustrophobia thing is gone. And then many people, like me, can see the dentist and have a dental approach to sleep apnea that doesn't require a CPAP mask at all. So many options on the table. Don't be afraid of getting tests. Information is power.
Yes,
And
it
once you
is.
know that, then you can work together. Also, don't forget the significant contribution that a chiropractor, craniofacial massage person can do to help relieve the structural component. Often, I was in a car accident, got a whiplash type injury, I have 3 herniated discs in my neck that led to TMJ dysfunction that helped my jaw hold out of alignment, worsening my bite. So there's another approach to treating the sleep apnea with manual medicine.
Yes, it
that's
is.
not a CPAP machine.
Sure. We
And
deal
if
with
I
that all
may,
the time.
I would like to make a link from what you're describing, Dr. Campbell, about sleep and low oxygen and sleep apnea as one of the underlying issues with lack of restorative sleep. And I want to make a link between sleep, low oxygen, hypoxemia, and obesity that we commonly see in all of
Right.
our practices. Between the three of us combined, we well know that about 2/3 of American population suffer with overweight or obesity, and that's rampant, which can cause an aggravated concern for sleep apnea, which can cause other issues and restrictive disease, low oxygen tension, which in turn puts them into increased inflammatory state with production of increased inflammatory markers
Hmm.
like tumor necrosis factor, interleukin-6, which have been implemented in cytokine storm with
Yes.
COVID-19. And there are several studies already, including a large study from New York hospitals, which indicate that more than 30% of patients who are sicker in the hospital and ICU have underlying obesity as a cause, as well as diabetes and other factors which weaken immunity. But obesity has been a large factor as a comorbidity named in studies, in which we also see an observation in our practice for COVID-19. So
I
obesity,
think that study just came out too, and there was one that was done originally, and I think there was a second study that came out with that, and obesity seems to be one of those major comorbid features. Um, Dr. Campbell, what about hypertension? Because what I'm
And it's
seeing,
a
and
vicious cycle too, because
go ahead, I'm sorry.
I was going to say it's a vicious cycle because when patients are obese, they tend to get sleep apnea, and sleep
Yes, they
apnea
do.
can cause obesity. And it can be this
Yes,
very vicious cycle. And
and they're
I've seen
feeding right off
patients
of each other.
lose 10, 20, 30 pounds just by getting their sleep apnea treated. No other intervention, no
Right.
change in diet, no change in exercise. Just get their sleep apnea corrected, and miraculous things can happen. Another thing
Yes.
that's interesting, connected to that, is that most sleep apnea patients have open mouth breathing. They sleep with their
Yes.
mouth open. That leads to a dry oral cavity. When their oral cavity is dry, the pH changes. The bacteria that are supposed to live there don't live there because it's inhospitable. The environment is not correct. And those bacteria that move in its place are inflammatory bacteria that do two things. Number one, they raise all of those inflammatory markers that Dr. Natasha was speaking about,
Hmm.
and they can oxidize LDL, and they can do all
Right.
kinds of ugly things to your vasculature, your arteries in your neck, leading to stroke, arteries in your heart, leading to heart attack. But also, they don't make nitric oxide. And nitric oxide is one of the signaling molecules that won a Nobel Prize. It's so important. And nitric oxide is made predominantly in the floor of your sinuses and the crypts of your tongue. Nitric oxide helps to open or dilate blood vessels. And when your blood vessels do not dilate and they're held down tight and clamped, that can be manifested as hypertension or high blood pressure. So open mouth breathing and sleep apnea can cause hypertension as well as sleep apnea through a couple of different mechanisms. So when I sleep, especially when I'm wearing my dental appliance, I literally tape my mouth closed so that it doesn't open while I sleep.
Interesting.
To help support the friendly bacteria that live in my mouth.
Right. And I think it's important for our audience to what Dr. Campbell was saying. There's good bacteria and there's bad bacteria. So we want the good bacteria to be living in our mouth, and we want all of the bad bacteria to move out. And there's an important distinction between those two. So tell me about. I've been reading a lot of studies. Hypertension seems to be this complicating factor: hypertension, diabetes, hypertension, cardiovascular disease, the hypertension and the obesity. It seems to be the elephant in the room, if you will. What is it about hypertension that is causing all of these problems with these types of patients that are being diagnosed with COVID?
Right. So what is hypertension? That's the first thing we have to ask, right? Hypertension is high blood pressure. When I was in medical school, we were told that a blood pressure of 180 over 100 was acceptable in an older patient. By the time I finished my training, we were down to 140 over 90.
Right.
Now we say a normal blood pressure is 120 by 80. And anybody between 120/80 and 139/89 is pre-hypertension, and hypertension's 140 over 90 or higher. Now, some people are even pushing that down to 130. It depends on who you pay
Right.
dues to, right? But somewhere, that magic number is somewhere between 130 and 140 or higher puts you at risk. Why is that? And where does that come from? Well, we think that some of it is a mediator that we can correct. Nutritional deficiency.
Mm-hmm.
What nutrients can people be lacking that cause elevated blood pressure? Vitamin D. Oh, that's a surprise. Vitamin D is a hormone, but it will lower your blood pressure, not a lot, about 6 over 4 or 5 over 3, but
Right.
bring it down about 5 points. That might be enough to get you out of a hypertension category and into a pre-hypertension category, potentially limiting your risk. So vitamin D is one thing. Magnesium. Calcium is necessary to make muscles contract, and magnesium is necessary to make them relax.
Mm-hmm.
So when you have low magnesium, especially in relationship to your calcium levels, your muscles are stuck in a locked position. And those muscles include the muscles that surround the artery walls. So we have been able to get patients' blood pressure down another 5 to 7 points just by getting them on magnesium. Many people are potassium deficient. We see a similar relationship in muscle contraction with sodium and potassium, and we see many patients deficient on potassium. Interestingly, some patients are even deficient in sodium. Sodium is also necessary. Now, you can definitely have too much sodium, and that will raise your blood pressure.
Right.
So some people are very salt sensitive, and it takes a clinician often to negotiate this with you to figure out, are you getting too much sodium or do you have not enough? Are you getting too much potassium or not enough? But in most cases in our clinic, it's not enough magnesium, not enough potassium, and too much sodium. Typically.
All going back to what you mentioned earlier, nitric oxide. Because nitric oxide is produced on the inside of the arteries, the lining that we call endothelium. So if they don't have enough nitric oxide, for a variety of causes, they can cause endothelial dysfunction, the dysfunction on the inside of the lining of the arteries that can contribute to the stiffening of the artery and raising that arterial blood pressure resistance against which the heart muscle has to pump the blood. And that is another factor.
Yeah. So if you think about a garden hose that is brand new, it's fresh, it's brand new, it's right from the store, you tie a knot in it and you turn the water on. What's going to happen to the hose? Probably nothing for a little while anyhow. A couple of minutes, couple of hours, couple of days. The integrity of that hose is excellent. Now, take a 50-year-old garden hose, tie it in a knot, and turn the pressure on. What's going to happen? That thing's probably going to spring a leak sooner rather than later. And in a human, if we turn on the pressure, because why? Because you're shoveling snow. That increases pressure. Because you just got really bad news on the telephone. because you have a virus infection with SARS-CoV that turns up the pressure,
Right.
and you have a weak spot in your arteries, those things are likely to blow. And when those arteries blow, we call that a plaque rupture, and that can trigger a stroke or a heart attack or a blood clot, depending on where the location is. And then you end up with these causes of death from COVID-19 because of this endothelial dysfunction pre-existing. You don't feel endothelial dysfunction in
No,
most
you
cases.
don't. Right.
And so you have no idea that you have it unless you happen to have a practitioner that has some ways to evaluate for endothelial dysfunction. We have a few tests that we can do, and we have a lot of blood markers that are indirect evidence of endothelial dysfunction.
What are some of those blood markers?
Yeah, so in my office we use myeloperoxidase, LPPLA2,
Yes.
F2 isoprostane, that's a urine test, and oxidized LDL. And when those numbers are elevated, we have a really good idea that you have endothelial dysfunction. Another one is ADMA and SDMA. These are paired tests, and they're asymmetric dimethyl arginine. It's a marker, an indirect marker of your nitric oxide status. So they're not direct tests. Some direct tests are things like endopat, which is like a blood pressure cuff sort of test that measures the actual reactivity of the endothelium when they put pressure on it and see the resistance and see how it recovers. I don't have that machine in my office, but some practitioners do, and it's a lovely test.
So one of the things, I'm sorry.
Test. I just want to say we do an endothelial test in the office with heart rate variability, which is also a correlation to endothelial dysfunction. So we do that, and it's remarkable to see someone before the intervention at baseline and after the intervention with just nutraceutical and natural approach, or maybe bioidentical hormones, how you can improve someone's endothelial function. And that gives us some confidence and satisfaction that we really improving their health outcomes for the years to come, as we're preventing those leaky vessels, that leaky heart with endothelial dysfunction that they had by improving their nutrition, immunity, nutraceutical status, and hormonal status.
Yeah.
We
do a carotid ultrasound test in my office, but not just the regular carotid ultrasound. If you go to the hospital or the Lifeline screening people, they'll do an ultrasound to look for actual plaque. That's important if we find it. We definitely want to know that. But 99% of the plaque builds up behind the artery wall, behind the endothelium. And so that measurement is called the carotid intima media thickness. And we can measure that with a very specifically trained ultrasonographer who's been educated in how to measure that very specifically. And we can track and monitor that. And the same, we see those CIMT numbers shrink, that plaque actually gets smaller over time as the patient corrects their mediators and fixes the things that can be fixed. Because some things we can't correct. I can't correct your genetics. If your family history is loaded full of cardiovascular disease, I can't fix your history, but I can sure as heck fix your future risk based on careful monitoring, tracking, and if you're willing to make the lifestyle changes that it takes.
Right, and I think that's the important part and one of the aspects of functional medicine. It's what we can do to help out an individual patient in the future to prevent getting to that root cause and prevent. So let's talk about some prevention. Dr. Campbell, let's go over some dietary aspects of this to help boost immunity. What are your thoughts on diet to help boost immunity?
Well, I think the same diet in general boosts immunity, lowers your blood pressure, builds your resistance. It helps modulate your weight management issues. So it's a clean diet. It's pretty much the same general basics for everybody, but the specifics are as unique as your fingerprint. And
yes, they are.
That's where the magic comes in functional medicine. right? So
talk about that magic too. I want to hear about that magic.
Yeah, so in general, we want to eat clean food. We want to eat local. We want to eat fresh. We want to eat green or brightly colored. Recommending 9 servings of vegetables a day for most men, 6 to 9 servings for most. I'm only 5 feet tall, so 6 servings of vegetables for me. 2 or 3 of them are leafy and green. 2 or 3 of them are brightly colored. 2 or 3 of them contain sulfur. Sulfur bacteria are there. Sulfur-containing vegetables are the kind that give you smelly gas, right? Broccoli, cabbage, Brussels sprouts, kale. These have onions, garlic. They have full of sulfur, which is one of the primary ingredients for helping your metabolism run smoothly and helping you to detoxify. So getting a diet that's mostly plants with a little bit of meat, if you choose to eat meat, is one of your best strategies. If you're going to eat grains, and many people can, then you want those grains to be whole grain. You want to eat whole grain flour, whole grains. That doesn't mean whole grain flour. It means whole grains. So you want the gnarly, crunchiest, grainiest things that you can get in your grains or seeds. We want no preservatives, no dyes, no artificial colors, no preservatives, no pesticides. Glyphosate or Roundup is one of the most toxic chemicals in our world today. It affects this pathway called the shikimate pathway in our mitochondria, which we share, which almost looks the same as a bacteria. And so glyphosate, while the Monsanto people will say it doesn't harm the human, it decimates your gut bacteria, which in turn makes you sick. So you want to avoid glyphosate as much as you can. One of the highest containing foods is Cheerios. People think they're eating healthier breakfast cereal, but it's made with oat flour, not whole oats. And those oats are not organic. And so those crops are smothered in Roundup before they're harvested. And the end food product is highly toxic to your gut. So we don't want you eating food out of a box. If possible, you want to get it at the farmer's market. Thank goodness we're having this conversation in June. Farmers markets are popping up everywhere. We have the best produce of the season coming up. We want to eat that local, support your local farmers, support your local farmers markets, and get the stuff that's fresh, and ask them as you're purchasing it what sort of fertilizers they use on their products. Try to go organic wherever you can.
And that's important, and that's a very fair question to ask them what type of fertilizer that they're using in order to help their crops grow. I think that's a very, very fair question. And I know that my wife, in fact, brought home Cheerios without me knowing it, and he loved it. I mean, it tastes good, and it's something that is palatable. And I remember, Dr. Natasha, we were reading an article not too long ago from the Mayo Clinic Proceedings. I think it was in November 2019, where those in Spain, they were eating a lot more processed foods, and they were getting away from that Mediterranean diet and how it caused havoc on their bodies, their immune system. But it's palatable, it's inexpensive, and it's readily available. Those were the 3 aspects that I remembered from this article. However, it's not good for our metabolism, our unique metabolism, our biochemistry. It works against us. And it's not something that we should be doing. And you mentioned gut. How does the gut come into play with COVID?
Well, first of all, it's important to note that about 80% of your immune system is located close to your gut. In fact, within 1 cell of your gut lining. So if you think about your gut as a tube that goes from your mouth down through your stomach, small intestine, large intestine, out your anus, one small tube that's all connected. On that other side of where the food wasn't, there's patches of lymphoid tissue. In the lymphoid tissue are immune cells, soldiers standing at the ready to help fight the battle against an invader. Because if you think about it, unless an invader punctures your skin, or gets in through your eyeballs, it's most likely going to come in through your mucous membranes of your nose or your mouth. That's how an invader is going to get in. So it would make sense that 80% of our immune system should be located in and around those mucous membranes. So when your body is under attack because you have eaten crap, fried food, preservative filled, artificial colors, artificial flavors, full of what we call non-nutritive, edible, food-like substances, right? Things that you might buy in a drive-through, for example. If you've eaten those things that are not really food, they create a significant inflammatory reaction in your GI tract. Mm-hmm. You don't feel it. It's not like if you scratch your face and you end up with scratch marks. You can see those and touch them on the outside. Your gut has very little sensation for that sort of inflammation. So you don't feel it. But what's happening is those little gut cells are starting to swell up. And as they swell, the glue that holds them together bursts. And that glue is called zonulin. And that glue begins to separate. And now food particles can be delivered between the cells. They're not supposed to go there. And food particles, as they get presented to your immune system goes, "Wow, what's that? That's a foreign invader. How did that get here?" And it starts to make antibodies to attack that foreign food substance. So we can now develop food sensitivities to many of these foods. Wheat is a very common example. And one of the reasons why wheat has become such a culprit is, like oats, wheat is heavily sprayed with Roundup. So the new protein, the way the wheat looks today in 2020, is quite a bit different than the way wheat looked back in 1955 or 1935 or 1995 when Roundup was first, when GMO corn and soy started coming out. And we started applying this multiple amounts of pesticide to our food crops. So this changed protein now triggers an immune reaction. The problem is that some body tissues look very much like those proteins. So if you have a thyroid gland in your neck that's reacting to the antibodies from the gluten that you just ate, you can now have an autoimmune thyroid condition that was triggered by a food that you ate. So you go to your MD, conventional endocrinologist, and they say to you, "I'm so sorry, you have Hashimoto's thyroiditis." This is an autoimmune thyroid condition that typically presents as an overactive thyroid, but don't worry. Eventually, your thyroid gland will be killed and you will go into a hypothyroid condition, and we will give you thyroid medicine for the rest of your life. Don't worry, we've got you covered. Right? That's the way we treat it.
That's correct.
In conventional medicine. And they say, no reason to ever check your antibodies again. We know you have an autoimmune condition. That's not what we do in functional medicine. We know that an autoimmune condition is a symptom of a much deeper problem that has a root cause that we can identify and correct. That root cause being an inflamed or leaky gut, which was caused by a poor diet that triggered an autoimmune condition that resulted in antibodies attacking your cell. So we clean up your diet, take out the offending foods. Often the magic that we talked about is doing a blood test that figures out what foods are triggering your reactions.
So we'll know exactly what foods you should be eating and exactly what foods you should be avoiding. Right.
Correct. And so we get that piece of information, and your Mediterranean diet now becomes the Dr. Cartalicchio modified Mediterranean diet that removes those foods. That's different than the Dr. Campbell modified diet, modified Mediterranean diet. That's different from the John Smith modified Mediterranean food diet. So once we get those little bits and pieces, we can then remove the food, re-inoculate your gut, replace what you're needing for optimal digestion, whether that's enzymes or stomach acid. We can repair your gut lining with nutraceuticals like glutamine and glycine and demulcents like licorice and slippery elm and marshmallow root. And we can allow your body to heal that inflammation, stop any further autoimmune attack. Clear out the antibodies by doing a little cleanse, help your liver to break down those antibodies, clear them away, eliminate them from your body, and lo and behold, that inflammation in your thyroid begins to settle down, the autoimmune attack stops, and we can reverse it. Sometimes there's other triggers, but that's a common one.
Right. It's all about controlling that inflammation, because that inflammation from these foods that we're eating, whether if you're eating a Mediterranean diet and you think that you're eating a good diet, because arguably you can say Mediterranean diet's great for cardiovascular disease, for diabetes. However, components of that Mediterranean diet, and that's what you were talking about, Dr. Campbell. There's a Dr. Fuxina, a Dr. Cardalicchio, a Dr. Campbell modified Mediterranean diet, because we're all going to be different. So the gut microbiome is very important in helping build that immune system, you know,
Right.
and eating those fermented foods, like something like sauerkraut or kimchi. I don't know if I'm a fan of kimchi. However, over here in our office, we're here in Newark today. Down the street, there is a hot dog stand, and they'll have sauerkraut. But I'm not going to go eat the dirty water dog. No, that's cut.
I can bring you some Russian kefir.
There you go.
Good
Right.
dose
And
of
almost
probiotics.
every culture has a fermented something in their diet. I'm
Yes.
Polish, so we have sauerkraut in our culture. Fermented cabbages of all sorts. Kimchi is one of those. We see yogurts, kefirs are fermented. Almost every culture has some kind of fermentation. Why? Because the bacteria that cause that fermentation process can reside in our gut and change that flora, shifting out the bad guys, pulling in the good guys,
Right.
and making a much healthier environment, which then makes a healthier immune system. Because
Correct.
when your gut is
Right.
leaky and your immune system's overreacting to foods, it's generally underreacting to infection. So if a COVID-19, SARS-CoV-2 virus happens to come my way, and my immune system is so busy being autoimmune against my thyroid and attacking every food that I eat, I'm not going to handle that infection as well as if I were eating the proper diet for myself.
Let's talk about some supportive nutrients. You hear a lot about, as we said, vitamin D, perhaps vitamin C, glutathione. Let's talk about some supportive nutrients that can help strengthen the immune system. So let's go with a little bit about vitamin D first. What are your thoughts on that?
Right. So I think vitamin D is probably the most bang for your buck vitamin that's out there, because technically speaking, it's not a vitamin at all. It's actually a hormone.
Right.
And so we think about vitamin D for bone strength with good reason. Vitamin D helps modulate calcium and phosphorus metabolism. Vitamin D tells your kidneys to uptake calcium.
Mm-hmm.
But it's actually vitamin K that tells your body what to do with that calcium once it's been absorbed. So really, vitamin D is one leg of a three-legged stool, on top of which sit calcium and magnesium. So if you're magnesium deficient, that's a problem. If you're calcium deficient, that's a problem. We need vitamin D, A, and K, all three for our immune system. I'm going to switch gears just a little bit, but I'm going to talk about vitamin A as well, because vitamin A, if you go into the World Health Organization's website and you look for the treatment of measles, which is a viral illness, the World Health Organization treatment for measles is 100,000 units of vitamin A for 2 days.
Wow.
So this is a place where conventional medicine advocates the use of a vitamin for the treatment of a viral illness. Switch back to the world that we're in today. Now we have another viral illness, and they're telling us there's no use for vitamins in conventional medicine. They're saying there's no known treatment for COVID, there's no known prevention for COVID. And while that may be true, because the research isn't out yet, we have volumes and volumes and volumes of research in basic science and in other illnesses that we could extrapolate to potentially save lives. And so I think vitamin A, maybe not 100,000 units unless it's your first day of illness, but 5,000 units a day is an excellent strategy.
Clearly.
I've been using a lot of vitamin A, if I can just interject with that comment, because it's a fat-soluble vitamin. So prolonged supplementation can potentially overload the body and cause toxicity. However, from research, we know that up to 6 months of supplementation with 5,000 units a day, it is safe to supplement without testing, and with higher doses up to 6 weeks. So in my practice, I've been recommending for prevention during the initial spike when we were approaching the peak of the curve, and now as we are ending the lockdown in New York and New Jersey, and we may see increase in transmission, I've been recommending between 10,000 and 25,000 units of vitamin A under physician supervision. I would not recommend someone taking it without consulting with a doctor, because I do know generally that in the short term, we can increase higher doses of fat-soluble vitamin along with vitamin D in higher doses to boost the immune system and to also improve tiny cilia in the respiratory tree, tiny cells that help expel the virus out and help boost our response, mobilize our little warriors, our army of the immune cells against the SARS-CoV-2.
Excellent. And I think a really important nutrient that's overlooked in almost every conversation that we have is water. Water is so important in your ability to fight coronavirus, because why? One of your primary areas of defense is mucus. Mucus should line your membranes of your nasal passages, the back of your throat, and all the way down your GI tract, and even into your lungs. And when you begin to get dehydrated, those linings get hard and crunchy, and that makes an opportunity for virus to penetrate. So simply by staying extremely well hydrated, you can reduce the dis-ease of your mucous membranes. And when you have healthier mucous membranes, you're less likely to succumb to an illness. I also like to wash those mucous membranes once or twice a day. How many times a day are we supposed to wash our hands? Yet conventional medicine doesn't recommend we wash our mucous membranes. But I think it's an easy and simple strategy to use some saline, salt water, and wash your nose. I have a neti pot in my house. I have a Brosen nasal irrigator in my house. It looks like a water pick with a cone-shaped tip that fits up your nostril. In about a minute, wash out your nose twice a day. A really healthy response at eliminating that virus and assisting your body's way to expel it so that it doesn't have a chance to hang out and make you sick.
I love that.
Other nutrients. So vitamin D we talked about because of its immune boosting, its hormonal effects, but it also helps regulate blood sugar and helps regulate blood pressure.
Yes,
So
it does.
we know that diabetes is a risk factor, in part because it's an oxidative stress condition. And if we can lower your blood sugar just a few points, vitamin D can help to do that as well. Vitamin C, probably the cheapest of all the nutrients to replace. The average person in my practice needs between 4 and 5 grams a day to get to vitamin C sufficiency. That's 4,000 to 5,000 milligrams, or 4 to 5 servings of emergency, right? That's a lot of vitamin C.
That's a lot of,
I recommend that particular brand name, especially 5 servings a day, because it's got other stuff in it. But we do a urine test in my office. You can also do a blood test for ascorbate levels to make sure that you have enough. An easier way to do that is to get a vitamin C fully reduced powder, mix it in a drink, and just start drinking it. About a couple ounces every 15 minutes. When you have a poop, that's a little more vitamin C than you need. About that, the vitamin C
go to
flush test. If you're going to use a liposomal vitamin C, you may not get that flush response because it's bypassing the GI tract. So a liposomal C may not be the way to do that, and liposomal C is more expensive. So I use plain powdered vitamin C to do a flush test to figure out your dose, or a urine test to figure out your dose. And then oral. For me, I'm lucky. I only need about 500 to 1,000 milligrams a day. but I'm the
Right.
exception. A lot of patients will need 4,000, 5,000, 6,000, 10,000 units, milligrams a day of vitamin C in order to have vitamin C sufficiency.
Mm-hmm.
And your adrenal glands are one of the
Yes.
most vitamin C hungry organs in your body. They by weight have more vitamin C in them than any other organ. Our stress environment is a whole nother topic for a whole nother day. And dealing with the post-COVID stress syndrome, which I think for many people is going to be more devastating to a larger number of the population than actually had the virus itself.
Yes.
And one thing we can do for our poor little adrenal glands is make sure they're getting enough vitamin C and enough sleep.
Yes.
Zinc. Zinc has many advantages. Three that I think of. Number one, you need zinc to make mucus. If you do not have adequate zinc, you don't make a good mucus lining. So remember, we talked about mucus as one of our first defenses, so take zinc. Number two, zinc is an inhibitor of the RNA-dependent RNA transcriptase, which is a fancy way of saying there's an enzyme that coronavirus mommies and daddies use to make coronavirus babies. Mm-hmm. If you block that enzyme with zinc, you don't make coronavirus babies.
There's no babies.
You don't get so sick. So zinc can do that. It doesn't get across the cell very well. It needs something called a ionophore to get across the cell membrane. We have several of them that we eat all the time. Things like quinine is one. That's where the hydroxychloroquine thing has come into play. We think onions may be a zinc ionophore. There's a few others, for some reason they're escaping me at the moment. But zinc
I usually
is a good.
give them quercetin for that reason.
There you go.
Quercetin is
walk
very
out
good.
on
Yes.
onions.
In a supplement form, it's just easier, I think, right now with prevention and with a lot of fear that's in people's mind, which is a whole other topic: fear, stress, cortisol, which depletes immunity. But my recommendation has been quercetin from day one, the pandemic started.
Yeah, and that's a good zinc ionophore. So it helps zinc do its job better. And the third thing that zinc is necessary for is the health of the nerve fiber endings that make you smell and taste. So if your zinc level is low, you don't have a good sense of smell or taste. We do that in our regular physicals. We ask that on a questionnaire. It's interesting that now loss of sense of smell and taste is now considered to be a coronavirus symptom. And I absolutely believe that that has to do with zinc. As the corona mommies and daddies are making corona babies, all the zinc is getting gone and all diverted, and now we're losing our sense of smell and taste. So having good zinc levels can reduce that deficiency and make our immune system stronger, our mucous membrane stronger, and our likelihood of getting that coronavirus symptom less. Right, selenium, that's another one. I was
just ready to go to selenium.
You can eat 2 Brazil nuts a day, or you can take 100 micrograms of selenium. It's also used in the cofactors that help to make your immune system strong. My colleagues have suggested that if we're only going to get one supplement, if you can only afford one thing, probably zinc would be what it is.
Would be zinc.
If you can only afford 2 things, I would do vitamin D and zinc. And then if you can afford the whole vitamin stack, then we're doing C and D and magnesium and zinc and selenium and vitamin A and maybe melatonin. Melatonin's interesting. We're not going to give you melatonin to help you sleep. We're going to give you melatonin because of how it affects your immune system and actually supports your immune system's ability to fight virus. So if you can tolerate it, some people can't tolerate high doses of melatonin. It gives them nightmares or leg cramps or whatever. So don't take it. But if you can tolerate a dose around 6 milligrams a night at bedtime as prevention, and if you get it, triple that, it can be a really profound addition to the vitamin stack for coronavirus.
What about glutathione?
Yeah, so glutathione is something our bodies make naturally. not nearly as much in our 50s and 60s as we did in our teen years. We think that may be some of the reason why younger people, generally speaking, without chronic illness, do really well. They catch coronavirus. They don't get very sick. Glutathione is considered the mother of all antioxidants. Its immediate precursor is called N-acetylcysteine. And if you are low in glutathione, you are high in oxidative stress.
Yes.
And Dr. Natasha spoke to you all about all the problems that you have with the endothelium when you're in a state of oxidative stress. So we can supplement with glutathione orally. Doesn't taste very good, but you can find other ways to make it better. It tastes very rotten eggish. You can use the precursor, N-acetylcysteine, or a combination pill that has both in it.
Both of them, right?
I like to use S-acetylglutathione because it's less degraded by the gut. But in my office, we have the advantage of being able to give it IV. So I give a lot of IV glutathione. So,
now, do you do a lot of IVs in your office?
We do,
Dr. Campbell.
We do a lot of IVs. In
Tell us about the IV nutrient drip. How does that help out?
The one we use the most is called a Myers cocktail. And
right.
these are the ingredients, and when you hear me list them off, you'll know why they help. It's vitamin B complex, vitamin B5, B6, B12, mixed minerals that include magnesium, manganese, selenium, and zinc. It's got vitamin C and glutathione.
And how do you find that? Do you find that helps out a lot?
Oh my gosh.
Yes.
Yes, it helps a lot. So we use it, for example, I had a patient that had to have dental surgery today. She came to the office yesterday. We gave her a Myers cocktail IV going into anesthesia so she can handle the procedure better. And we'll give her another IV tomorrow or the next day whenever she's feeling well enough to come back in to help her in the recovery. So we use it in that instance. We use it pre-op and post-op for anybody who's doing anything. We use it for people who are feeling run down. That same Myers cocktail not only supports your immune system, it supports your adrenal glands. So
gives you more energy.
In high times of stress, it's like drinking a Red Bull without the negative side effect, right? Those things can kill you. You got to be careful with them.
You want to stay away from the Red Bull. Go for the Myers cocktail. It's much better
for you. Go for the Myers cocktail, right. And it's administered with somebody with the knowledge of your unique biochemistry. And often in my office, we have lab values, so we know who needs them and who doesn't. We have people who take them preceding a very stressful event. They're coming up to their wedding. They're coming up to
so are you saying, Dr. Campbell, that a wedding's a very stressful event?
It can be, yes.
It can be, yes, it can be.
So we have people who use that, and often, by the way, those B vitamins and minerals make your skin glow.
Yes.
So people use them as an anti-aging strategy sometimes as well. And we also give extra hydration. So if you happen to have had too many adult beverages celebrating that wedding, we can do a Myers cocktail post-celebration to help you hydrate and
you'll feel a lot better.
NAC into it.
Yeah.
And you'll feel a lot better.
A lot better.
And also for the listeners, Myers cocktail is a general term, and it was invented by Dr. Myers, but different practitioners may put different concentration of certain vitamins and minerals into the Myers cocktail, and custom tailoring to unique person's biochemistry or disease or wellness state. As Dr. Campbell has mentioned, if you have the luxury to see a physician who can test your micronutrient levels and know your level of oxidative stress, so the individual components and the concentration in the Myers cocktail can be changed. It's not the same formula, one fits all, between the practices or for all patients.
Right. So we're about an hour right now. As you can see, this is why Dr. Campbell is one of my favorite people of all time. She has so much knowledge. She helps out so many patients, and she's a great friend. Do you have any? I want
to make a plug.
Go ahead, tell me.
My girlfriend